Hi guys, welcome back to my channel. My name is Susan and I am a nurse practitioner and I am based here in the US. I am so happy that you chose to come back and watch my videos. To be honest, I am so humbled by your gestures of believing in my content, subscribing to my content, and sharing. Please, please, please subscribe, share, and like my videos. I'm here to support you. I am here to empower you, and I'm here to be your partner in your health journey, either personally or in something that you're pursuing to do in healthcare. So, one of my subscribers asked me, what is the difference between a registered nurse and a nurse practitioner? So, today I am going to explore the difference between the two in terms of educational pathways. And I'll reflect on my own personal experience, the things I did correct, the things that I wish I did better, so that I can spare you the hustle and bustle of finding out exactly what you need to do to get on your path towards obtaining your degree in nursing if that's what you choose to do, and in many other areas too, to be able to navigate the educational system here in the United States. So, to begin with, in order to become a registered nurse, for me, I came here when I had just finished high school. So I went to a community college. I think that's the best place to start, especially if you've not had any higher education anywhere else in the world. So you can kind of navigate how the education system is, how the tests are conducted, how to answer questions, and just know your expectations in the education arena. So, getting into a community college, I got in and I had to do a placement test. And what that placement test does is that it categorizes you in terms of the level that you will place, either in English and math. Both are required. So once you do those placement tests, for example, I was placed in statistics for my math, and in English, I was placed in a class that was equivalent to what was expected of me. So from then on, you work to getting your prerequisites. For me, what I did was taking a bunch of classes, trying to get into different programs initially because I didn't understand exactly how to navigate that piece. I knew I wanted to get into healthcare, but I didn't know what the path was. So I took a couple of classes to challenge myself. I wanted to go to med school. I wanted to go to pharmacy school. I knew I was supposed to be somewhere there, and I knew I wanted to pursue nursing as well. So I got an advisor who kind of narrowed my interests down to the classes I needed to get into the program that was in my school, my college program. So I started doing those prerequisites, and once I completed them, I was placed into the nursing program. Of course, you have to have a good GPA because the nursing programs are very competitive, and I scored well, so I immediately got in. And when you go to a community college, you're expecting a diploma after you have completed your course. So you get, for example, I got my registered nurse degree. Of course, you complete the course. It takes about 2 years when you're in a community college, and you get to do your NCLEX board exam, state exam, that you're licensed within the state that you live in. With that path as well, you can choose to go to the LPN program, which is another nursing program that takes 18 months, for example, and different schools offer different programs, curriculum. So that is another path you could choose to take if time is a factor for you and you want to get started working immediately. So an LPN does the same kind of board exam, the NCLEX, but their scope of practice is also different from a registered nurse scope of practice. So that's the differentiating facts between the two. So you get your license to practice in the state that you are enrolled in, and then you start working. You can either choose to work while you go to school, and if you're pursuing further degree, That would be a bachelor's degree. For me, I chose to work for about a year or two, and then I went back for my bachelor's degree. And depending on the type of school you choose, mine took about 3 years to complete because I was doing part-time while I was working. So the length of time varies depending on the school that you choose. So you can choose an online program to complete your bachelor's degree. You don't get to do a separate exam to continue working as a registered nurse. It just increases your opportunities and your knowledge base to be able to care for your patients and to just set you apart from everyone else. And different organizations, for example, acute care settings, nowadays require most nurses to have their bachelor's degree. So that's another added advantage. An LPN can also go back to school and take about a year to complete their nursing degree, and they get to sit for the board exam based on the state that they work at, and then they complete, get their certificate, and then they work as a registered nurse. So that's another path. For me, I got my bachelor's degree and I continued working. When you get your nursing degree and you start working, I think that's the best place to start looking into whether you want to go back to school and which specialty you want to be working in. For example, after you graduate, you can work as a registered nurse in an acute care setting. You can work in an ICU. Some nurses pursue ICU path because they want to become nurse anesthetists, which is an advanced practice degree, and you are required to have about 2 years of experience in the critical care environment before you can apply to that program. So some nurses choose that path. You can work in a pediatric clinic and provide care to pediatrics. And with that, you are able to think through if you want to go back to school and become a pediatric nurse practitioner. You can work in mental health and become a mental health nurse practitioner, psychiatric nurse practitioner, and you can also pursue other types of practices. You can work in rehab and become a PM&R nurse practitioner. So there is a plethora of areas that you can work in. And of course, primary care, working in clinic, it offers you a variety of scope of interest that you can use to pursue your degree. For me, I worked a couple of years, and as I was making my decision to go back to school, of course, there are different factors you look at when you're choosing a program. So I will be touching on that in another video so that I can guide you if you're interested in going back to school to become a nurse practitioner. For me, I worked in different areas as a registered nurse. I worked in oncology, I worked in renal, I worked in rehab, and I worked in home care. And I worked in an acute care setting, so I floated in different environments, which offered me a scope of interest that was very beneficial for me in terms of pursuing my degree in family nurse practitioner. So those are some of the paths that you can choose to pursue. So a registered nurse and a nurse practitioner, the difference. So you become a registered nurse and decide to go back to school and become an advanced practice registered nurse. There's two paths to that. You can either go back to school and get a master's degree. And when you get a master's degree, you get in family and in all the other areas that we have touched on, and you become a master's prepared family nurse practitioner. For me, I decided to choose a school that offered the doctorate program, and the doctorate program offers the terminal degree in nursing, meaning that it's the highest level in nursing practice that you can achieve, and with that you become a doctorate prepared nurse practitioner. And specific areas that you choose, for example, I chose to pursue family nurse practitioner program. So I saw patient population from unborn children, of course, pregnant women, and all the way to geriatrics population. So I was exposed to so many variety of patient population, and I enjoyed rotating in those different specialty areas. And I will be touching on that on my next video, and how to navigate your clinical sites, and how to have a work-life balance if you're choosing to work and go back to school, and how that will look like. Of course, after you're done with your program, either a master's degree or a doctorate degree, you sit for an exam, a board exam, and then you're certified in the state that you are in, or you choose to work in. And with that, we will also explore what you need to do to keep your license as a family or any type of nurse practitioner that you choose to pursue. So it's a very rewarding career, and I feel that I chose the right path, because there is so many things you can do in nursing, so many areas you can expose yourself in. You have an opportunity to save lives, you have an opportunity to make a difference. And I am always humbled by what I don't know, and that is always the reason why it pushes me to go farther and farther and challenge myself to what I can do better. I am still learning even today on how to become a better nurse practitioner in my specialty area that I'm currently working. So I'll also be touching on different things that you can do to continue building yourself in your career and being the best version of you in whatever capacity you choose. So thank you so much for joining me on my video today to discuss the difference between a registered nurse and a nurse practitioner. Please, please, please share this video, subscribe and like, and let's meet on my next one. Have a good one. I love you all for subscribing. I love you, I love you, I love you, and I'll see you on my next one. Bye. We've come to the end of this video. Please subscribe, like, and share, and I'll see you in my next one. Bye.